Bernard Fuemmeler is an associate professor of family medicine at Duke Health and the founding director of the mHealth at Duke Consortium Initiative. I'm sure he'll talk a lot more about that today. His research is seeking to develop innovative intervention strategies to promote family health. He's funded primarily through the NIH and has published over 50 peer-reviewed journals with a master's from Harvard and a PhD from Oklahoma State.
So, let's see. I'm a scientist, a researcher. I'm going to try to communicate clearly. I'm here out of my environment, so I should get some points for that, I think. So I'm a behavioral scientist, and the research that I do mostly involves children and families. And I wasn't exactly sure what I should talk about. Mouse. But what I thought I would do is provide a little bit of an overview about where we are in terms of some of the emerging trends in mobile and digital technology and some of the challenges that we in the health science community see as major challenges. They may not be your challenges, but I think that they're important challenges to overcome if we're going to start integrating digital and mobile technology within the health sector. Let's see. So I want to provide a little bit of a background and then tell you a little bit more about some of the things that we're doing. So first of all, 70, 50, 25. 70% of adults will die of a chronic health condition. 50% of adults have one or more chronic diseases. And 25% of children have a chronic health condition. And the most common behaviors that are associated with this are insufficient physical activity, tobacco use, unhealthy diet, excess alcohol intake. These contribute to about 80% of chronic health conditions, right? And 40% of cancers. But the problem is that we're not spending money to address that. We're spending money to address clinical management of chronic disease. And we spend over $8,000 per person per year on healthcare in the US. And only $251 of those dollars is going towards prevention. And we're not getting any benefit from it, right, really, compared to our other counterparts across the sea. You know, our life expectancy for the amount of money that we spend is not any better. Other countries are spending far less money per person and achieving greater life expectancy. We're not getting any better quality either. So these bubbles represent how much we're spending. The US has the biggest bubble here. And on the left, you see the overall ranking. Our ranking, quality healthcare ranking, is the lowest. We're spending the most money in the US. We're not getting better quality. We're not getting better quantity of healthcare. Fortunately, we are seeing some emerging trends in healthcare, and this was alluded to before, but you know, we have been operating on a sort of break-fix model where reimbursement is based on quantity. But we're moving a little bit more towards a preventive model where reimbursement is based on outcomes. It's a value-based model. This was mentioned by Tom. At the same time, we are in this sort of digital revolution, right? You know, data is coming from everywhere. We're all connected. The Internet of Things is all around us at this point. And Nick mentioned that this, you have to keep this in perspective. We haven't been here for very long. It was only 2007 that the iPhone came on the market, and in 2008, the Android system. And their app market only came in a year later after the introduction of those iPhones. So it's less than, what, 10 years that we're talking about here. But the beautiful thing about the iPhone, right, is that it connects things. It connects our devices. It connects our scales, our Fitbits. It connects our blood pressure cuffs. And it allows all of that data to be transmitted to the cloud, Epic, whatever it is that we're trying to get it to. But it also allows for feedback for the patient themselves. So, this is the hub that connects everything, all our devices, and this is very useful. Now, one of the things A lot of the innovation in this space, though, is coming from the industry, right? And when we look at the number of apps that are out there, there are more than 100,000 health apps right now on the market. Now, 82% of them generate less than 50,000 downloads, and only 5% of them achieve more than 500,000 downloads. So the penetrance is not very great, and the types of penetrance that is there, they're focused on the sort of worried well. You know, people that really do want to do better in terms of tracking their physical activity, their diet. This is great. You know, this is very helpful. But a lot of the apps are not designed for patients. They're not designed to address a relevant clinical need, nor are they designed to address the issues of chronic disease prevention, which is where we need to use the technology the most. But the hope is that, you know, smartphones will result in smarter healthcare. So the idea being that we can increase the access to care through mobile technology, digital technology. We can lower some of the admin costs that are associated with moving patients in and out of the healthcare system. And potentially we can avert the costs associated with acute events by monitoring people in the field outside of the physician walls. So it's not hard to imagine how digital and mobile technology can affect both higher quality and reduce costs. You know, it can make personal information more relevant at people's fingertips when they need it. It can improve the coordination of care. These are important aspects in quality of care, quality of healthcare. And it can reduce costs, as I mentioned, by providing opportunities for intervening before acute events occur. So some of the challenges that we face, I think, in the health science sector, and health research sector in this area, are evidence, engagement, and embedding. And I'll talk to you a little bit about some of the work that we've been doing to try to address some of these challenges. So evidence, what is evidence? Evidence, you know, is about if something's working the way it's supposed to be working, and is it incorporating information that is evidence-based. That's what we want out of our technology. We did a review of about 200,000 apps on the app market. This was the early app market, so there weren't as many health apps on the market at that time, but this was 2009 and 2010. Not too long ago, but still not very many. We reviewed weight loss apps, and we sort of looked at those apps and asked how many of these apps have evidence-based materials in them. Do they contain evidence-based content? Because we know what it takes to improve weight and diet. We know the science has recommendations on how we should go about this. So we wanted to know, do these apps have this information? Surprisingly, we found that most of these apps don't, right? Only a few of them covered one or two behavioral strategies. So you can just, oops. So you just see that the top ones is a percentage of the apps that covered 3 or more strategies. Very few covered many other of the strategies. We concluded that many apps have insufficient evidence-informed content. And you might say, well, you know, that was 2010. You know, that's so long ago. There's lots more apps on the market. More recent reviews have come out. They find the same thing. These two authors published separate articles reviewing some of the apps. And what did they conclude? All the apps received low overall scores for inclusion of behavioral theory-based strategies. Apps don't have behavioral strategies for evidence-based weight loss. So these authors are concluding the same thing as we were concluding. This is not particular finding related to weight loss apps, though. Smoking cessation apps, same thing. A review of smoking cessation apps. They don't adhere to clinical practice guidelines. This one is on breast health. There's lack of evidence and medical professional involvement in the development of apps. This one's on sports injury prevention. Only 4 contain claims that could be supported by available literature, and 5 contain false claims. So there's a market out there, but it's not a good market right now. And the reason is that we're working on silos. You know, we're working separately from one another. The app developers are doing a great job of developing these very flashy apps, but they're not communicating with other people, the patients, the developers, the healthcare providers. And what do we have? We have apps that don't contain much evidence. The other issue that's very challenging in this space is engagement, and this was alluded to by David. How do we engage patients in the use of the technology that we want them to use? So what we've done is try to use gamification techniques to try to involve, in this case, we're working with cancer survivors. And because part of what I do is try to work on health promotion, health prevention, we designed an app that would allow kids to track their diet and their physical activity, but do so in a fun and engaging way. And so we developed this app called Mila Blooms. We focus on cancer survivors because they're at risk for obesity. If you're an adult survivor of pediatric cancer, you have a higher chance of being obese than your sibling, for example. Okay, bad word, branding. But here, we thought of the idea of developing a consistent theme and message to our intervention because we wanted to bring kids into the development process. So we brought cancer survivors in, talked to them about some of the challenges that they're facing, shared with them some of the ideas that we had, and together we came up with some solutions. And some of the things that came out of those initial conversations was sort of this idea of mountaineering and how cancer is really something that's difficult. And you go through it as a child, and hopefully you come out on top, but you don't do it alone. You do it with the support of others. And so we incorporated this idea of mountaineering into a game that we developed called Mila Celestial Blooms. And the idea was that it's 2089, the Earth has been destroyed, and it's up to a band of survivors to find the Mila petal and restore Earth's balance. And there's all the consistent elements of a game. We have participants play as a team, and they advance through a series of expeditions. The storyline of the game evolves as they play the game. And it has the points, badges, and levels that are rewarded for engaging in the use of the actual tool. We actually wanted to incorporate challenges, so we offered them health challenges every week. So part of good nutrition is knowing how much you're eating, what a serving size is. So we had them practice out measuring serving sizes, and we incorporated that into the sort of the play of the game. I'm just going to show you a few screenshots. Here we have a screenshot which shows the participant, their avatar. It masks their identity, so nobody knows exactly who is who in the game. And they can drill down to find more information. There's like a store where they can buy rewards for completing the challenges. There's an entry system for logging their diet, where they can log their diet in red, green, and yellow foods. Red foods being unhealthy foods, green foods being healthy. They receive feedback. They receive information about what a serving size is. And this was before the Fitbit, so we had a wireless pedometer that had to be synced with the phone, but they could sync the phone. They receive some feedback. They can see where they're at in terms of how close they are to their goal that we helped set with them. There's a chat screen. We thought this was a great idea. They could communicate with one another within the game and go through the game together. We also had a platform in the back end, so we can see everything. There's a health coach that sort of helps the kids along the way through the process of playing the game. So we have complete control of the game mechanics, the ability to see what's happening in real time. And so far what we've done is completed a small feasibility trial where we've just given kids this and asked them to use this for 8 weeks and wanted to just observe what kinds of problems we were going to be encountering at the time. And after they played it for a while, we did receive some good feedback from them. They did say that this is something that they enjoyed. It was not too difficult to use. I'm going to skip that for now. We weren't really powered to look at any changes in actual behavior, but what we did see is that kids that were using the app actually benefited a little bit more than kids that weren't. So they were they reported eating less sugary, less added sugar in their diet. And I'm presenting this just to show how important it is to really begin to look at the data to help inform future iterations of the design. Here what we found is that some kids were super users. So over here is total steps, and that's green foods. So we had some kids that were just using it all the time, some kids that were in and out, and some kids that just never picked it up. And part of that had to do with the technology itself. We had some technical problems, but another part of it had to do, again, I think with David talking about in terms of motivation to engage. If they're not motivated to even play the game, we can't get them involved. And we need to work better at the front end in terms of sort of onboarding people into the game process a little bit more efficiently. Before we give them the game, making sure that they have the information that they need to make the decisions to actually play the game. Another key issue about engagement is multimodal design. And by that I mean you're using a lot of different channels to communicate with people. And some of the other work that I'm doing involves research studies, research trials. These are not clinical trials per se, but we are working with cohorts of patients. So we involve mothers and their kids in longitudinal studies. And clinical and cohort studies share something in common. They're both very expensive. They take a lot of resources to get going. And engagement of participants is critical to the success of these trials and these studies, right? Because participants need to be engaged through the course of the study. And retention is a big issue. We spend a lot of time on the phone with our participants, getting them to come back to their study site visit, or getting them to fill out the questionnaires that we want them to have, or just tracking them down, making sure we have the right phone number. So we've built a platform that helps assist with this process, and we are using different channels to communicate with our people in the field. So instead of approaching this from the idea of using an app, we're basically using existing technology and sort of allowing that to serve as the platform. So we are sending automated voice messages that can be received by patients. We're sending text messages, and they can also get email messages. And one of the nice things about this is that it reads our database and can send automated messages based on key features that we have in our database. So if we want to send people information about their next upcoming visit, it reads the field about their next upcoming visit and sends the targeted message for those people. So if we have 800 people in our studies, it can go through all of that and automate that. We may want to send information to everybody just to say, Merry Christmas, Happy Holidays, whatever. So we can send groups of information, or we can send targeted information. The other nice feature about prompt is that it allows for feedback to go back into the system. We may want to know, are they moving soon? Do you expect to be moving soon? And they can send that information back to us, gets re-entered into our database, updates their address code. That's very important in keeping people involved. The other issue I mentioned was embedding. And so one of the things that I've been working with the team at UNC is trying to figure out ways of bringing some of the technology solutions together in a larger package. So rather than just developing an isolated game, we're trying to figure out ways that we can deliver messages in an embedded system. So we're using digital technology to increase HPV vaccination among parents, providers, and preteens. And so we're developing communication channels for each of those constituent stakeholders, if you will. And so we have developed a game. This is kind of part of what I do. We developed a game called Secret Gardens, and it's all about how to protect your secret garden. And within the context of playing the game, they learn a little bit about HPV vaccination. So we capture their eyeballs and deliver a little bit of health information about HPV vaccination, so they're aware of what it is. We also are using courses, online courses, to communicate with physicians. So we're developing communication channels where physicians can sort of learn, how do we talk to our patients about HPV vaccination. And the third piece is we're developing, I don't have a slide for this, but we're developing a way in which parents can receive information that's directly tailored to them. How do they talk to their kids about this? How do they make decisions about it? And what questions do they have? So the challenge is, again, evidence, engagement, and embedding. And I think evidence will be achieved through greater partnership. through greater partnership of people with complementary expertise, so people working together to solve a problem coming from the different standpoints, whether it's industry, whether it's healthcare sector, the science sector. And data-driven approaches that are grounded in theory is also part of what we need to develop. So, we need to learn from our data about how to make better improvements. And then engagement, I think these personalized and targeted approaches. So we're trying to develop strategies. The way we typically operate is we develop catch-all strategies, and we need to think about who are our target audience, who are we developing these for, and including them in the process of the development. And then embedding what we develop within systems. So rather than thinking about something that operates outside of a system, I know going into Epic is difficult. We don't do that either. But we try to think of it more broadly in terms of how is the technology going to be used with other pieces that can advance the sustainability of the technology. So if you want to find out a little bit more about some of the other things that are going on at Duke, this mHealth at Duke consortium, I direct, and you can go to the website and learn a little bit about some of the presentations we've had. We've had some very exciting things going on, some Shark Tank competitions, and we have a conference every year on April 15th, Tax Day. So encourage you to see that. So thank you very much for your attention, and thank you for inviting me to present. I'm happy to answer any questions or, yeah.
Just in relationship to apps in general, do you feel like current apps right now, how are we going to change the kind of social structuring and the social conditioning that goes on with like apps today, where you get the feel-good kind of placebo effect, but you're not really getting anything of benefit out of it other than, ooh, I did my part and I got my little 80 steps in and I'm here, but then you go and eat a cheeseburger and you just negate it all. So I do agree that there's a collaboration effect, but more, I guess, along the lines of getting society to shift that perspective dynamic to go away from the fast food feeling and actually do something of benefit to help them.
Yeah.
And making it in that platform that streamlines it.
Yeah, I mean, I think the thing about it is that there are consumer products that we like, and I've got some of them now. And does it help me? I don't know. It doesn't really, but the technology really is useful only if we put it into practice for solving real problems. And as long as we have the sort of emergence of technology that's sort of consumer driven, it's really not going to make a benefit for the health sector. We need to be partnering with our partners at the health institutions and with providers and with you guys in terms of trying to figure out what problems are arising in terms of how we can use the technology to better sort of serve patients' needs. So these technologies are great and they're fun and we enjoy them and we buy them. But the question about whether or not they can actually make a benefit in people's lives, I don't think so. And if it's just being done in isolation or for consumer goods, we need to start thinking about these technologies as being part of solutions that we really care about.
I love the idea that you presented about gamification. I think that's a hot area of research right now. I'm interested, though, if you've looked at all at both the long-term endurance as well as, I guess, generational differences. Because I think about, 5 years ago we were all playing Farmville, and 2 years ago we were all playing Candy Crush, and probably no one has those apps on their phone anymore. And I know that the app that you talked about was more geared toward kids. I know that I, as an adult, with a million things to do, I'm certainly not going to sit down at dinner and check in every little thing I have for my meal. So what have you seen at both of those kinds of?
Well, I think the issue of the gamification is a powerful tool, and what some people worry about with gamification is that this idea of intrinsic and external rewards. So external rewards do good at sort of shaping your behavior, but once you remove the external reward, does the behavior continue? But if you develop a creative, fun game, then you are developing something that's fun. and engaging, and we enjoy it. So that kind of process is actually intrinsically rewarding. When you're doing something that's fun, it's intrinsically rewarding. So it can have a lot of the sort of extrinsic elements, but it needs to be part of something that's actually going to be engaging. And I think it speaks to what's your target audience. If you were born after 1970, then you're a gamer, because we grew up playing games, the Atari and everything else. If you're born before that, you're not quite a gamer, but you're interested because you want to know what's happening with all these fun things that people are doing. So I think that it goes to sort of speaking to that, to tailoring your product or your solution to developmental age. And I think when you're dealing with kids, when we went into our focus groups, we had kids that said, "This is really great, but I wish there was something I could shoot." And we said, "That's good feedback, but we're not doing it because we don't want to promote that." So we had certain values that we sort of said, "No, not going to do it." But we tried to make some of the other elements as part of the game. So, speaking to your audience, trying to figure out what they want, and knowing, who they are is going to sort of be the biggest bang for your buck. And so, older people, they want to play games too, and gamification can be useful in sort of getting people involved in the technology. The degree to which it sustains people in the technology, the degree to which it actually gets people on board, is not quite clear, because we struggled with that.
I think the idea of gamification could definitely improve patient compliance. When we started off with paper diaries, with patients who would sometimes fill out their diaries, and then we started giving them, telephones that were not connected to anything, right? No wireless device, but they would enter in their data. So at least it gave them a little tablet to enter things in. But maybe if we made it even more entertaining and made their patient diaries almost like a game, like you're saying, gamification, that would further enhance the compliance in completing their questionnaires. Is there anything out there that's making patient diary more enjoyable instead of just, did you take your pill at 9 a.m.? Yes, no?
Yeah, I mean, I think that some of the sort of the tools of gamification could be employed there, right? So, LinkedIn and a lot of other websites have their sort of, how much you've completed of your profile. Do a little bit more today. And, this need to complete something is really inherently human. We don't want to have things uncompleted. So, those kinds of small gamification techniques can be very useful in sort of getting people to sort of do what you're hoping them or expecting them to do. And there's no reason why we shouldn't use some things like that. Does it need to be an elaborate game where they're battling things in the universe? Probably not, but we could probably learn something from the industry of gamification and apply that to making more engaging platforms for our consumers.
But if our target was kids, then making it more gamification would be perfect. If there's an app for picky eaters, I probably need to look that up. That's something I use at home. But,
I think that, yeah, I did. Yeah, there actually was somebody that I met, and I can't remember her name, but yeah, there are a few of those. But I have a 2-year-old, so I can sympathize with that.
I would just add too, I think that there's an opportunity not just on the patient tool side of it, but the site staff and thinking about the technologies that we have as far as EDC or electronic source. I mean, inherently we all like, and I think I had a conversation with Doug many years ago, and I called him actually from a casino in Las Vegas, because all around me you saw crazy people staying at a machine well beyond what they should have, because there was a little flash going, "You're a winner." You're a winner was after 5 cents, but still. So I think that there's some opportunity all around us. I mean, because we all share in that. It's not just patients, but thinking about physician investigator engagement, staff engagement, and so all these tools that we have around us.
Yeah, most definitely. I would like to develop a game for providers, right? So like that they can sort of earn some points as badges and levels, so that they maybe do a better job of caring for the patients.
What we've found, we have a patient in engagement app that runs on our phones, and what we found is using game theory doesn't have to mean badges or jumping up and down, but you can do things just showing tasks and showing how many tasks you have and how many tasks you got done. We humans respond to like, oh my gosh, I'm at 10% and I'm in the red. I mean, that's just terrible. And I want to get into the green. So what we found is if you can just track tasks and color code tasks and put people in red and show where they need to be to get to a green, people will work to get to a green. And it doesn't have to be, you know, and for kids, badges and stuff is great. But, you know, I'm not going to work hard for a badge, but I don't want to be in the red and be like in those guys. I want to be green, you know?
Right.
So
It's not trivial, you know, really creating creative strategies like this. And I think you mentioned, you know, if you're showing them where they're at and what they need to do to get there is sort of the biggest piece, because otherwise it's demoralizing.
yes, absolutely.
Right. Okay, thank you.